I'm Dr. Prashant Malhotra. I'm a pediatric ENT surgeon at Nationwide Children's Hospital in Columbus, Ohio. I take care of kids with hearing loss and of milder losses all the way up to cochlear implantation. I started my surgical training 15 years ago, and I have been working specifically and primarily with children with hearing loss as a surgeon for 9 years. At Nationwide Children's Hospital, we are one of the busiest pediatric cochlear implant centers in the country, and we do approximately 60 to 80 pediatric-only cochlear implants a year, every year. I think many families, rightfully so, because children are young when we're considering cochlear implantation, are worried about surgery in a young child. The difficulty that we encounter is that what we know is that spoken language development and the benefits of cochlear implantation are, there's a window of time of which we can maximize what can be done. And that puts a sense of urgency about when we can do a surgery. So the fear of surgery is a big thing. So a lot of families think about the risks of surgery and all the possibilities that could go wrong. And also then, sometimes they think then that families they want to wait until the child is able to make the decision themselves. And so that gets wrapped up into that sense of we don't really have the ability to wait. If a family makes a decision they want a child to make the decision on their own when they're 10 or 18, then they've already made the decision for them. Because after about 3 years of age, then a child will not be able to do the same with the sound as if they were implanted at age 1. The surgery for a one-sided cochlear implant takes about 2.5 to 3 hours. They will go home the same day. There's an incision behind the ear. I don't have to shave the hair at all. It's not a brain surgery, it's an ear surgery. We do standard ear surgeries on the eardrum and other parts of the ear, and this is a very similar and standard approach for that. Children will have a little bit of pain that's mild to moderate levels of pain for a couple of days afterwards, usually managed by Tylenol and Motrin alone. And oftentimes a challenge for the families is that the kids are actually very active after a couple of days. So for current surgical practices, one of the things that I typically try to employ in all surgeries is something called a soft surgical approach. This is something that we try to do especially in children who have any hearing that we might be able to preserve. But there are certain things we can do that limit the amount of trauma to the cochlea, and we try to do that in every surgery. Also, the current types of equipment that the manufacturers have made have come a long way over the years to the point that they're a lot more flexible, they're much less damaging to the cochlea. So we do have, in this day and age, the ability to preserve hearing in the low frequencies especially, but some ability to even preserve hearing to the point that if a child has the ability to use a hearing aid in that same ear that has an implant, we want to try to keep that. It is not a guarantee for all children, but the fear that a lot of people have about the concept of sacrificing hearing, I think is kind of a moot point, because we're not really talking about usable hearing. A child who's being considered a candidate for a cochlear implant is someone who's not benefiting from hearing aids, which are trying to use the existing abilities to hear. The hearing aids are trying to stimulate the living cells in the cochlea, and when that is not working, then the cochlear implant helps to plug into the area behind the cochlea itself to the hearing nerve cells. And this is why a child who cannot benefit from a hearing aid can benefit from a cochlear implant.